So I'm snapping 1, 2, where are you? You're stealing my heart.
إنك أنت الله لا إله إلا أنت وحدك لا شريك لك وأن محمدا عبدك ورسولك.
Today is the day, like I have pediatric ward. I will start today, inshallah, too early, to prepare the patient to be visited by the senior itself to see the situation, if it is in progress or if it needs some modulation. That in children, you should see the saturation, pulse rate. So you should be prepared as usual. Our patch, indeed, might be lost stethoscope. Starting early is the key to know what you have in the ward itself. If you have a critical patient, start with them. Indeed, I have PQ and also child or kids ward. In the PQ, I like about 5 patients there. I think I have 2 patients on CPAP. I will give you some tricks to see and to be sure the CPAP is working well and the patient has good air entry. Okay, and I will also show you how to make the morning and night too for children or for the neonates itself. So let's start, inshallah, and we'll see the main part on the clinical part of our tour itself. So first part, look for the documents of the patient and also for the treatments of today. Document today, 26th of February, and also checking their treatment if it's correct or there's something has been added, it is not here, it's not found here. So we'll see, inshallah. أهم شيء بالأطفال هي الرضاعة، مو؟ ليش الرضاعة مهمة؟ أول شيء على مود ياخذ صحته، 2 على مود طريقة الرضاعة ما تأذي الطفل وتخنقه. ليش؟ لأن طريقة الرضاعة خاصة هسه هاي الردات كلها هناك مليئة بالأطفال المرضى بسبب شنو؟ الأم ترضع بشكل خطأ، ومرات الأم تكون عجوزية وتسبب مشكلة والتهاب صدر الطفل وذات الرئة، وتدخل في مشكلة كبيرة احنا في غنى عنها. طريقة الرضاعة للطفل لازم الطفل يكون أول شيء مستوى، يعني مستوى شبه أفقي. أوكي، من ترضعه أباشر له بالرضاعة. هل نفسه سريع؟ إذا نفسه سريع هنا أوقف الرضاعة، مو؟ ليش؟ يعني ممكن قطرة من الرضاعة تروح للرئة وإنه تزيد الطين بلة. من أشوف الطفل نفسه سريع، ما مرتاح، أكله مو زين، شهيته مو زينة، مو؟ حركته مو زينة، أشوفه مو طبيعي، أجيبه أوديه للطبيب مباشرة. زين، بدينا نرضع الطفل، قح، اختنق، غاص، ازرق، بهالحالة شو أسوي؟ أوقف الرضاعة وأيضا أجيبه للطبيب. ما صارت هالأعراض أكمل رضاعة. كملت رضاعة الأمور تمام. الخطأ الشائع عند الأمهات شنو؟ إنه يرجعون الطفل مباشرة بشكل نايم عدل، اللي يسبب شنو؟ رجوع الحليب إلى الرئة. ليش؟ يعني الطفل بعده العضلة العاصرة السفلى بالمرئ من جوا بعدها ما متطورة وراخية. هذا الرخاوة ترجع الحليب. إذا حطيناه هيك، شنو اللي يساعد ما يرجع الحليب؟ إنه الطفل بهالشكل يكون، مو صحيح؟ بعدها رضعناه ربع ساعة إلى نص ساعة لازم الطفل قاعد، هم ما اختنق، مغص الامور تمام، اكمل رضاعه ان شاء الله يا رب بالصحه والعافيه. وهذا one of the main important thing to educate your patient or the relative of the patient to for their sake or the sake of the health of the patient to prevent aspirated pneumonia. See you later. So this is patient on phototherapy. First of all, when you start the tour of the patient, when you start to examine the patient, start with counting of the respiratory rate. Cause patient, especially when the patient is calm, do not irritate the patient, which will indicate the irritation of the patient. After like examine the patient, like auscultating them, you will like evoke them and make them cry. That will affect the respiratory rate itself. So this patient on phototherapy is crying, respiratory rate is good, clear chest, alhamdulillah, and high TSP. Inshallah will be better, inshallah, at the night or tomorrow maybe, and you will be discharged. So one of the duty is putting the NG or OG to be specific for this child, which is very helpful here. He's sucking, that's why it will be more easier. We'll see. So this patient on CPAP is 550, and we'll see. One of the main important thing to see is if there is a good air entry or not, because sometimes there is nasal obstruction. Also, pneumothorax could be happen, so we should be sure if the patient has good air entry and so on. So basically, this patient on phototherapy, respiratory rate was 42, but he has respiratory effort and subcostal recession, so and decreased air entry bilateral. So we suggest or suspect that this patient has nasal obstruction, which already has been occurred before, and for nasal wash. After nasal wash, we will see this patient. If this patient also continuing the respiratory rate increasing and respiratory effort is also increasing and subcostal recession is not improved, then we will switch to NG feeding again, and we will also monitor this patient like closely. This patient also has splenomegaly, hepatomegaly as well, which is I think normal in neonates. As you see here, and he is calming, but still he has decreased air entry, so we should make for them nasal wash because in this age there is heavy nasal secretion, and this child has no ability or they do not know how to aspirate from their mouth. So their mainstay of aspiration is their nose. If there is any obstruction, will leads to respiratory problems. When you're working on periphery, most likely you will get many Taiwanese there, but it depends on them. Most likely you should accept their gifts from because they will be ashamed, and also it depends on the type of gifts itself. If it is like orange and so on, take it. Don't worry because they will be they will feel uncomfortable, and they will think that you are an arrogant person. One of the mainstays in case shortness of breath and cough. When we increase the O2, not effective, not a bigger bus has been settled, but also it's not effective. This is a case of tough teratology of buttocks, and he needs a surgery, and he is now in a spell. In a summary, any case, if you want to differentiate between is it cardiac or is it respiratory,
by O2, one of the thing by O2. If it is response, then it is respiratory. If it is not response, it's a cyanotic cardiovascular disease.
Now it is like at the midnight. Still working on. It was very busy day. It was very hard day. I have too many patients who has been admitted today, and they were tired with a congenital heart disease, and they are unstable, unfortunately. And I suspect one of them gonna die, unfortunately. Inshallah, he will go on, but unfortunately he's very tired and he is not operable. So I'm suspecting that patient is gonna die today. Let's continue. I will continue to repeat the treatment, all the treatment of all the patients who has been admitted here, and keep going.
What do you want? I think she has a kids. She was keeping telling me like she was speaking with me. Okay. لا هذا سبعة جبرت. نصيحة دائما المريض التعب الحقوا ورا تحاليله. هسه أنا رايح أدور التحاليل مال هاي شوية ديكم بيصير هاد شوية وتعبانة شوية.
Thanks to God, the day has been ended well. Let's say well. No one died. Alhamdulillah. The congenital heart disease patients still alive, but they are tired indeed. So I hope you enjoyed. I hope you got some information from this video. See you soon, inshallah.